Thanks, Dan. This is a 42-minute lecture I gave in February that I'm going to try to give in 10 minutes. So I think strip harvesting or linear strip excision is a dying art. It is, to me, very important because there are certain candidates that are just better for it. Women are fantastic. There's no shaving. There's no these protracted non-shave techniques, and you just get the best donor area. In addition, men with very advanced baldness, they have a Norwood 6 or 7. You don't have enough grafts to harvest safely, and I think we're going to have some problems in the way we predict FUE. In other words, where we're harvesting very close to the crown of these 30-year-olds, you look at them maybe in 10 years from now, you could have exposed scars and problems that you didn't predict and lost grafts. So be careful and look at all the tools that you have. In 2017, this has been a big revolution, is that instead of using blunt or sharp punches, which predated that, these hybrid punches use a combination of sharp outside and blunt inside, and it's an oscillation going in rather than a high torsional rotation. So the graft quality and survival now is really on par with strip procedures. I have no affiliation with any company. The key here when you're planning this out is mark it out and divide it so that you can actually plan your harvest. And so this is an example. I harvest first, so let's say I have 2,000 grafts and I have 14 box marked out. That's going to be 142 grafts that I'm going to harvest per box. But let's say in this 8 central ones, I want to harvest a higher number because those are higher density. I have 175 grafts there, and if you multiply 175 by 8 and subtract it from 2,000, then you get the delta of the remaining 6 boxes. And that way, as I'm progressing, every grid that I finish, I ask my staff, what's the number? And they give me the number and I can keep progress. Because when you're under high magnification, you can tend to over-harvest one area or another. And you want to mentally subdivide a grid. You want to follow the natural flow of the hairs. And I always harvest from left to right, bottom to top, on the right side, follow to the left side. The reason is my staff are extracting on my left, so I want to be out of their way. And that leads me to my next point, which is don't skip around. You want to follow because the hairs flow in a sub direction. If you skip around, you're going to really slow it down because the hair angles shift in very subtle ways. And when you have a small case, like an eyebrow case, I spread them out as far as I can so long as I don't go into that unsafe area of the crown, because that way, if they ever want to shave down their hair more, there's a little less risk of hypopigmentation. And as you know, FUE or strip, neither one is scarless despite the online marketing. So these are some pearls on how to harvest. The key thing is I'm looking down over the patient. I'm always looking at the side, the graft above. In other words, toward me, I'm looking at how that hair could shingle over the one I took out. So that way you don't create a void. So when you're harvesting, always think of the side above you to minimize that problem. I really believe that you can't get good anesthesia in the backside using a high concentrated anesthetic or a ring block. I use FUE tumescence. You're welcome to take a photo of this. Essentially, dilute Marcaine lasts the entire day. And it's like the Klein philosophy, which is more dilute the longer it lasts. And at these high volumes, you don't have toxicity. So I always harvest a few test grafts because I want to make sure that before I make recipient sites, that the sites will fit the grafts before I harvest 2,000 grafts, make the sites, and then realize nothing fits. And I always make recipient sites first because you don't want to have to over-harvest. So if I make, as I showed you, 2,000 grafts or 2,000 sites, I know I need to harvest a little over 2,000 grafts for that. So it's the exact opposite of a strip. When I harvest a strip, I do that first so they can have time to dissect. And from a 2-centimeter segment, I can project the number of what I'm going to do for recipient sites, exactly the opposite when I'm doing FUE. I really believe these 8.5x magnification has just been a game changer for me. I went from 2.5 to 4.5, and these are from Surgitel, no financial affiliation, with a xenon light source. You can see every micro change of the angles, and it just facilitates the harvest. Another trick is I use woven gauze for FUE and I use non-woven for strip, and the reason is non-woven absorbs better, but when you use it for FUE, those little fibers get tangled in your device. So I use a woven gauze. I sit above the patient, a little bit higher than the patient, in a very relaxed position, and I'm always looking at different angles and changing my body if I'm getting any level of transection. This is a critical thing. Shave the hair short enough, especially in African American patients, because you're going to get fooled by the hair curl. The hair curl is not the exit angle, is not the angle on below the skin. If you follow that curl, if you look in the left, you're going to transect. What you want is to follow the blush, which is the next slide here is, look, you see that blush where there's circles there? You can see them on more than those, but those are the most obvious. That blush is where I target my direction, because that tells you where the direction is under the surface. If you have these hair shafts, especially with a long curl outside, you're gonna transect. And then for African Americans, what I can actually harvest with the same size as for a Caucasian or any other race, because what I do is I actually follow the arc. I actually look at the external curl, and I know that if I can take the top half of that curl going down and stop short enough just past the dermal release, I don't need a much larger punch. But the fooling thing is that if you don't shave it close enough and you follow the hair curl, you're going to transect. So you need to arc down perpendicular to that. This is the key with good harvest. This is the #1 slide I want you to remember. A lot of times we focus on FUE quality as a visual element, and it is half that, but it's actually, to me, over 50% the feel. So what you're feeling for is you're feeling for an erector pili muscle release, and sometimes there's still a little bit of dermal adhesions left. And you know that because you can feel it going down. The other thing too is that you want to hold your device really gently and loosely and toward the tip, because if you hold it firmly, you can't feel it. And if you hold it lightly, it actually will autocorrect the direction. So if you're slightly off angle and you hold it loosely, your device will, if you're using an oscillating device, will actually pull you in the right direction. So these are little pearls, and then you want to confirm it. And we're going to talk about that in the next coming slides, which is that you want to confirm it. Play that video if you don't mind, thank you. You're going to see the graph pop up, and that's another visual confirmation that you actually have it released appropriately. Always use 2 forceps extraction, even if you feel like the harvest is very easy, because you're going to potentially cap one, but in other words, pull it off on the top, which we'll show a slide on that. So you always want to be gentle, and I always extract my first few grafts because it tells me, am I deep enough? Am I transecting? Where am I transecting? What's going on? I don't give that extraction portion over to my assistant yet, because I want to know my feedback. And even as I'm incising, my corner of my eye is looking at I can actually see transection before they call it. As they're pulling it, my eye is seeing 2 things as I'm harvesting. So this is really important, is I want the feedback on the perifollicular tissue. So my staff has been trained as they pull out, not only to call out a transection, which they'll say 1 out of 3, or they'll say 2 T's out of 3. They will also say need more tissue, which means I'm not going deep enough. If you're not going deep enough, you're going to have problems in terms of graft quality and survival. So you're looking for that really good perifollicular tissue. You want to look for feedback on the graft quality. So my staff are constantly feeding me back on what's going on. Am I capping? Capping basically means that I've not gone deep enough and they're yanking off the top. Hooking means I've actually gone too deep, because when that bottom portion is whirled all the way to the bottom, you're going to actually distort and cause torsional injury to the bottom. Everyone knows what transection is, and stripping is just like a little more less than capping. You've gone just deep enough to pull it, but you're stripping off the tissues, and it means you need to go a little bit more deeply. So this is the feared thing. I see this almost every week, and it breaks my heart. People that have no idea what they're doing are completely decimating donor areas. And I will tell you that you think strip scars are bad. When you have this, there's no exit on it. So please, if anything, if you forget one slide, or if you remember one slide, don't over-harvest, please. And as you know, if all you have is a hammer, the world is a nail, please understand whom you should not operate on. I can spend a whole day and turn away 9 patients in a row. Don't be having salesmen meet your patients trying to sell them everything that moves. You need to understand hair disease. You need to understand who should not have a surgery. Those are young patients, patients with scarring alopecias. Those are patients with unstable hair loss. Those are patients that have not been medically managed. Please do the ethical thing when you're doing work on these patients. And as you start your career in FUE, understand it's going to suck. And the first few cases, you're going to rip your own hair out. But you will get better, and the learning curve is so much shorter now with these oscillating hybrid punches. So these are just some of my works, FUE scar correction, This is done with FUE, FUE for African American men all day long. This is FUE eyebrow and beard transplant. This is a mega session with a strip. This is FUE to correct FUE. This is FUE correction of 2 strip procedures. This is a combination beard FUE and strip to correct a bad strip procedure. This is a combination strip with beard to correct slot and punch. This is a strip for female hairline lowering. This is a strip procedure for female hairline. So key pearls is use 8.5x loops, look for the blush, ignore the hair curl, reposition your body if you're getting transection, hold the instrument loosely, feel the release, feel for transection, look for the quality feedback, which is perifollicular tissue and no transections. Follow the gentle process as you go, don't skip around, be conservative, and absolutely please do not overharvest and destroy lives. I have no financial affiliations from my books or courses. They all go to charity. This is a book that came out as more of an encyclopedia, which pushed me to do this book, which is really a 101, 116 videos. It's really meant to help you guys learn. This is pre-sales are at QMP right now, coming out in 2 months. This is my master course, has also been filmed, that came out 2 months ago. And please come to my hands-on cadaver course in July. Again, I make no money on any of the things I've mentioned. Thank you.